More than 1 year after Ontario began rolling out vaccines in high-risk communities, a team of University of Toronto students have released their own research project evaluating COVID-19 vaccine clinics in hotspots.
Although the government is saying it's an equitable one, that they did a 3-stage rollout vaccine strategy, the fact is it failed to accompany policies necessary in these marginalized communities.
The conclusion by a team of community researchers who looked at the rollout for racialized youth at Jane and Finch and in Rexdale.
Many of these communities have essential workers working in these communities, as well as they come from a variety of multi-ethnic groups.
The researchers who also live and work in those areas looked at experiences accessing vaccines from pop-ups and mobile vaccine clinics, inequities and areas for improvement.
When it comes to low-income communities, it was more of a, here's a vaccine clinic, come and get the vaccine, we know you need it. And so I think that provided more of a quick fix instead of actually catering to people's needs.
In the preliminary case study, 12 student participants between the ages of 17 and 22 shared their experiences between March to December 2021. 90% of them had 2 doses.
All of our participants mentioned that they had to jump through hoops to access these quote unquote equitable and accessible clinics. So it really calls into question how accessible truly are these clinics.
They released 6 key recommendations to improve vaccine clinics in hotspots, finding that although getting the vaccine was straightforward and fast, there were organizational challenges, including lack of communication, disorganization, and inaccessible vaccine booking processes.
The community also said they didn't feel like they had time to vet the people that were coming into our spaces and giving us these vaccines, and it also felt like an afterthought.
They say the location of clinics should be decided along with community members, as transportation was an issue for some who had to travel and wait all day in long lineups.
They didn't take the route of equity, and I guess even though they had some race-based data, they weren't able to effectively use race-based data to target the communities that need it the most.
Ontario's Ministry of Health did not provide a response to CityNews in time for deadline. The City of Toronto says it continues to work with health and community partners to remove barriers and, quote, Toronto Public Health has regularly monitored and evaluated how the COVID-19 vaccines are delivered, and we have adjusted the campaign as needed to ensure all residents continue to have access to vaccines. The students who won U of T's research symposium also interviewed 4 community leaders responsible for vaccine rollouts in their neighborhoods, and they're hoping to discuss their findings with policymakers.
What we're seeing is not necessarily groundbreaking. Like, these issues have been present for a long time, and that's something we heard with a lot of the community members. They've been saying they've been calling for action for like 10, 15 years.
The community researchers are calling for more enhanced and focused COVID-19 policies and data, and for more experiences, both positive and negative, to be captured in other Toronto hotspots. In Toronto, I'm Faiza Amin for City News.